Hello, everyone, and thank you for joining us for this evening's webinar. My name is Susan Spurlock, and I am the Patient Navigator for the Overactive Bladder Program for Chesapeake Urology Associates. Today we are presenting It's Time to Regain Control of Your Bladder and Bowel, presented by Dr. Andrew Shapiro. During the program, if you have questions, please email webinars@cua.com. And now I'd like to introduce our presenter, Dr. Andrew Shapiro. Dr. Shapiro is the director of the Center for Continence and Pelvic Floor Dysfunction at Chesapeake Urology Associates and chief of urology at the University of Maryland Rehabilitation and Orthopedic Institute. Dr. Shapiro, now I turn this over to you.
Thank you, Sue, for the very nice introduction. My name is Andrew Shapiro, and we're going to be talking today about overactive bladder. We'll go through a little bit of the history of overactive bladder and how we can help you. I assume that most of you who are either listening or watching are either personally infected or have a family member who are quite bothered and affected by this very troubling, very bothersome disease. So again, we're going to talk about where there's some hope. You're not alone, and there are certainly things that can be done to help you. Again, my name is Andrew Shapiro. I'm with Chesapeake Urology. I'm the head of the Continence program. I'm also the chief of urology at the University of Maryland Rehab and Orthopedic Institute. And over my 14-year career, this has been my passion. This is the main thing I focus on is bladder problems and trying to help people who have issues with bladder control. Many of you be very familiar with these statements, very similar to this. I drink less before I go on a trip. I miss the best part of a show. I need a bathroom nearby, or otherwise I won't make it. I mean, these are things people think about on a daily basis. Another common one I'll often hear is, I'm perfectly fine sitting. As soon as I stand up or as soon as I get out of the car, all hell breaks loose. So these are things that people think of and really disrupt their life. And the bladder and the bowel can have significant impacts on the way we live our lives and the impact it has on ourselves, both the person and their loved ones. So it's important to realize you're not alone. This is a very common problem, and there are more and more treatments and things we can do to help you. You don't have to feel like there's no one else out there who has it, or there's nothing that can be done. There's certainly treatments, and I think it's important you speak to your physician, because again, there are certainly things we can do to really help improve your quality of life. This overactive bladder is a very common condition that affects an estimated 50 million people in the United States alone, which is a pretty significant impact. An additional 20 million suffer from bowel incontinence. So many of you sitting here listening or watching this webinar may have both bladder issues as well as bowel issues. Sadly, only half of those with severe symptoms ever seek treatment. So people who have mild or moderate symptoms very frequently never actually seek treatment. They don't realize it's a problem. They think it's maybe a normal part of aging, which it's certainly not, or maybe there's nothing that can be done. Again, you're not alone, and there are certainly many good treatment options we have for you, which we'll get into in a little while. But it's important to realize this is very common. So I think it's important to understand your condition, get a feel for what's going wrong, and then what we can do to try and help the situation. So we'll talk a little bit about how the bladder works, and then again, go through some of the treatment options. Overactive bladder, the main symptom is urgency. Again, we're going to focus on that because that's why most of you are here today. But just understand that some people have not only problems with controlling the bladder, but have difficulty emptying the bladder, and may have bowel urgency and bowel leakage as well as bladder problems. And one of the treatments we're really going to talk about a little bit later on can potentially help one, two, or even all three of these problems. So if you have more than one of these problems, again, it's important to understand that we do have good treatments that may actually help all three of these issues for you. So let me tell you a little bit about how the bladder normally works, and what you'll sort of quickly understand is that this is not how your bladder works. But I'll give you a little picture of what maybe normal is. Again, there's a huge range of normal, so take this with a grain of salt, but just to give you some ballpark idea. Yeah, the kidneys make urine, and as the more you drink, the faster it makes urine, and the bladder holds it. It should stretch like a balloon, and will start to send signals to your brain. Maybe at around half a cup, they'll say, I'm just starting to sense something. I don't have to go, but I'm just starting to feel something. Maybe about a cup or 8 ounces, you could comfortably go. No rush, but if you're socially appropriate, you might go. And then maybe around 12 to 15 ounces, it's getting pretty strong. You want to go soon. And so what you hear is you get a progression in your signals, you get control, and you get time. And that's not what most of you have. Most of you will be sitting there 1 second, and all of a sudden, boom, you really have to go. Or you get out of a chair, you get out of a car, and it hits like a ton of bricks. You may feel like you're going to explode. You go to the bathroom, and an ounce or two comes out. And that's the problem. You can't comfortably hold urine very well. And that's that sudden, strong urge that often goes along with frequency, and a lot of times not making it on time. So, and this is often a problem between the connection between the bladder and the brain. So sometimes the signals aren't quite right. Again, we're going to talk about some of the treatments for this. I've used the word overactive bladder, which is a clinical term that we use as physicians. What does it mean? The main symptom, urgency. That strong, sudden desire where you really have to go. It's not normal. Again, you may feel like you have to explode. You may have an ounce or two in your bladder. Sometimes it's more, sometimes it's less. But urgency is that main symptom. Some people will drink 3 liters a day and go frequently, but it's controlled and there's never a strong desire, that sudden desire. That frequency alone certainly can be normal, but that gnawing, irritating urge is not normal, and neither is wetting yourself when you can't get there on time. So the main symptom being urgency, but it goes along usually with frequency, waking up at night, and then some people have incontinence. Incontinence tends to be a little more common in women versus men, because certainly men suffer from this as well. So looking at this picture, I think it's kind of really reflective of what goes on, that basically your bladder is taking charge. It's controlling the situation. It's controlling your life. You may be doing an activity you like, and you have to stop suddenly because the bladder is telling you, you go this way. And again, this is often an abnormal connection between the brain and the bladder. And it can lead to this sudden, strong urge. And this, you need to go, and you need to go now. And then, again, it may cause bathroom mapping, or it may do something outside of your norm. You may have to stop. You're at a movie, you may have to rush to the bathroom. Now, normal bowel function, we're kind of just going to gloss over this because, again, the main theme of today is overactive bladder. But I think it's important, again, to understand that one of the treatments we'll talk about towards the end can have an impact on normal bladder and normal bowel function. So those of you who are suffering from not only bladder issues, but urgency and loss of bowel incontinence or soiling may benefit from one of the treatments we're going to talk about shortly. Fecal incontinence, again, touch briefly upon this, is loss of control of your bowels. You can't make it to the bathroom on time. You're either having strong urgency or you're having leakage of bowels. Now, your condition can really have significant impacts on your quality of life in multiple areas. So these are just some examples below on the screen. Physically, you may limit participation in activities you normally would have loved to do done. You're afraid to go outside and play with your kids because all of a sudden you may have to run to the bathroom and not be able to make it. Reduces your social interactions. You're afraid to go out with friends, to go to a restaurant, to go to a movie because you may wet yourself and it's embarrassing and you have to carry extra clothes with you. Certainly alters travel plans. If you're on a plane, you're on that window seat and you've got to suddenly go, it's a real challenge. A lot of people blame themselves. They think, well, I'm a teacher or a truck driver. I didn't take the time to stop and I hurt myself. And that's not true. This is a medical problem. You certainly didn't bring this on yourself. You certainly didn't wish for this. So blaming yourself is certainly not the situation. Some people avoid having sex because they wet their partner, they wet themselves during sex, which is incredibly embarrassing. Work, you're at work, maybe you're wearing protective gear, you're in a room you can't get out, you're in a big office, and it's hard to get there. So all of these things play a role psychologically in how you deal with this. And for those who don't have this problem, it's hard to understand how much this truly impacts your quality of life. Wearing protective gear, having to wear diapers, having to go out to Walmart or a supermarket and buy adult diapers is really embarrassing and life-altering. So again, you're not alone, and we're going to talk shortly about things we can do to really help the situation and really improve your quality of life. So it's important to understand your condition is not a normal part of aging. Yes, it's common. As we get older, this does become an increasingly common problem, but it's certainly not universal. Not everyone suffers from this, and it's certainly not a normal part of aging. It's not a normal part of just being a female. Just because you're a woman doesn't mean you're going to get this, doesn't mean you need to suffer from this. And it's also important that if there's men in the audience or you have spouses or loved ones who they can get this too. And it's important to understand a lot of times the prostate gets blamed. It's not always the prostate. Young men, men with incontinence, men whose prostates have been managed or have small prostates, certainly can have this problem as well. So it's important to understand that the bladder needs to get looked at as well, because again, as men get older, this becomes an increasingly common problem. Yes, they tend to have less incontinence and more urgency versus women, but there are certainly men who can have urgency and certainly can have leakage. And last, this is not something, again, you did to yourself. So this is often related to another medical condition. Sometimes we don't know why it happened, but this is certainly not something you brought on yourself. And male, female, any age, there are good treatments we can use to try and really improve your quality of life and improve the situation. The good news is there are certainly treatments to help regain control of your bladder, bowel, or both. And we're going to walk through in a minute, again, what the treatment options are. And it's important to understand it may not be the first thing you try. Sometimes it may not be the second thing, but again, we have a long list of options, and they've gotten increasingly better over time. We have more treatments. They're less invasive than they used to be, and they certainly can be quite effective. When we start talking about your treatment options, it's really important to develop a pathway. So when we look at, this is individualized. This is not cookie cutter medicine. So when we talk to people, it's important to really go through and come up with a path to treatment and getting them better. Talk about their history, talk about what bothers them, and then their goals, and try and march down this treatment pathway until we can really hit your goals, really improve your quality of life, and really give you better control of your bladder and or bowel, again, depending on what's the situation at hand. We start by a simple history, physical exams, usually just some minor office tests like checking your urine, maybe doing a harmless, painless ultrasound to make sure you're emptying your bladder. And then we start down the treatment plan. And we'll go through that. This is the patient care pathway. We always start with conservative treatment. By the time some of you have seen us, or some of you have seen me in the past, often you've gone through the conservative treatment. But if you haven't, we start with some lifestyle modifications, trying to minimize caffeine, stimulants, maybe some time avoiding, trying to prompt you to go to the bathroom a little more routinely. And then we do some active treatments. There's a couple different types of medications, and there's physical therapy or pelvic floor exercises. And sometimes the combination of medicine, therapy, or both can be quite helpful. For those of you who don't meet your goals or haven't tolerated the medicine as well as you like, that's when we start moving on to alternative treatments called advanced therapies or third-line therapies. And there are several of these we're going to talk about to try and really help the situation. Sacral neuromodulation, tibial nerve stimulation, and Botox are the three approved treatments. Urinary retention, again, the primary focus is to talk about your overactive bladder and your leakage. But for those of you who have problems emptying your bladder, and we're talking about sacral neuromodulation towards the end. Don't worry about the word, but I'll explain in English what that means. But that's, again, another treatment that can help both urgency, leakage, as well as difficulty emptying your bladder. And again, we'll talk about the bowel incontinence, the same thing. It may help all three of these issues. So the initial treatment for overactive bladder, again, busy, if you're looking at the slides, a little bit busy here, but basically make it quite simple. Lifestyle modifications, some urge suppression techniques, trying to retrain your bladder, possibly some formal physical therapy. These are some of the conservative, non-invasive treatments. Alternatively, what's very common in the United States is to try medication. There's a couple types. There's what's called anticholinergics, which are a little bit older medications. And then there's a drug called Myrbetriq, which I personally prefer as a first line because it's a little bit better tolerated in my opinion. But either one, or sometimes both these medicines can be helpful. We reassess along the way. How are these medications, what the things you're doing to try and modify some of the behaviors of drinking coffee and tea, and some of the exercises helping. For those of you who do really well, perfect. That may be enough for you. For those of you who need a little bit more, that's when we start talking about the advanced therapies. And I think it's really important to understand that managing overactive bladder is like managing high cholesterol, diabetes, high blood pressure. These are chronic medical issues that sometimes require more than one thing. So if you look at someone who has diabetes, they may be on metformin, diet, and insulin. And not everyone, one pill is going to work. Not everyone's diet is going to work. So we kind of layer things in to try and really work on your problem and get you to where you want to be. And again, medicine may be part of the solution, but we may need to move on. And so now we're going to talk a little bit about what things as urologists that we really focus on. And all the next three things are things we routinely do in my office. These are large parts of my practice for people who just don't reach their goals with medication alone. So the first one is called percutaneous tibial nerve stimulation, PTNS, or I like to think of it as an office-based acupuncture-like treatment. So this is the least invasive. It's not quite as effective as the next two options, but it really presents a non-invasive option, which can be done in the office with really no risk, which is quite nice. So these are 30-minute in-office treatments. Initially, it's once a week for 12 weeks. You sit in a comfortable chair, as you can see in the picture. Usually it's a little more comfortable because we have a reclining chair, so your leg's not stuck on a little stool. But you put your leg up, a little needle, an acupuncture-sized needle right behind the ankle. And you can see there's a little PTNS device. That's a little device which gives a little mild stimulation. So you feel a little numbness or tingling in your foot for 30 minutes. After that, you go home, you come back weekly for 12 weeks. And the majority of people see a moderate improvement. It does take about 6 treatments till you really start to see effects. So it's certainly not immediate. It does require maintenance. So if this works after the initial 12 treatments, you come back once a month. So again, the advantage is it's safe. There's no side effects. It's non-invasive. Most insurances do cover this, which is really nice. The downsides are it certainly takes a lot of time. It may not be quite as effective as the next two options, but it does present a non-invasive option for many of my patients. Second option would be Botox. So for those of you who wonder how does Botox work in the bladder, you're used to it for wrinkles and cosmetics. It's really the same concept. So when you use it for cosmetic procedure, to relax those wrinkles, what you do is you're injecting it into a muscle to relax that muscle. So for those of you who may have heard of Botox for migraines, spasticity, excessive sweating, there's a whole list of reasons why we use Botox, and it's the same impact every time. What you're doing is you're injecting into a muscle that's spastic, and it's relaxing that muscle. So for those of you who have urgency and leakage, what's happening is that muscle is, your bladder, which is a muscle, is starting to fill, and then it's spasming. And so by injecting Botox, we're allowing the muscle to relax. Therefore, it allows your bladder to hold more comfortably, and it reduces that spasticity or that leakage. So the advantage of Botox is it certainly appears to work better than the first option, the PTNS. It's a lot less time. It's generally a 5-minute procedure once every 6 months on average. I do have some patients who go once a year, but the typical is once every 6 months. So you're getting a pretty minor, pretty successful office-based treatment that lasts 6 months, which are all the upsides. And again, it's easily done in the office for the majority of people with just a little local lidocaine. The disadvantage of this compared to the first one is it's a little more invasive, and there's a small risk of having difficulty urinating afterwards. So if you inject 100 people, maybe about 6 out of 100 will have temporary difficulty emptying and might have to catheterize. Which is certainly a possible disadvantage. But it does offer, again, some of the upside of increased benefit, pretty minor, and again, it lasts about 6 months on average, and it can easily be repeated. And again, most insurances do cover this quite well, which makes it nice. The last option is something called sacral neuromodulation. And what we're doing with this is it's a device which modulates or changes the activity of the sacral nerve, which is the nerve in the buttock area, to help restore or improve both bladder and or bowel control. So this is the one therapy among the three that if you have bladder urgency and leakage and bowel control problems, or just bowel control, or difficulty emptying your bladder, can help 1, 2, or possibly all 3 of these options. So this is really nice because it gives you a chance. A lot of patients come to see urologists, they don't realize that their bowels are an issue, or they don't realize they can talk to us about that. And their GI doctors may not be able to offer them much. So for some people who have both bladder and bowel problems, this is a really nice option. And the way it works is we do a relatively non-invasive office test. We put a little wire underneath the skin in the buttock area, so just above your tailbone and the bone called the sacrum. And it's a little needle stick. You wear a wire to a temporary external clip-on battery for about 5 to 7 days. And this gives you a non-invasive, safe trial to see how well this device is going to work. So you'll get a really nice picture of what this is going to do for you and how well it's going to work before you commit to doing a minor outpatient surgery. And for those of you who this works for, which is the majority, you do a minor 30-minute or an hour outpatient surgery through a couple little incisions to implant this device. The nice thing about the device is it's far more permanent than the first two options. In general, there's two devices on the market. The newer one, which we're going to talk about in a little more detail, the battery lasts a minimum of 15 years. So again, minimum. So it gives you a really pretty permanent option to try and manage both your bladder and or your bowel symptoms, again, through a very minor, relatively safe outpatient surgery. So going through, the new device on the market is called Axonics. This was approved last year. And I was involved in the clinical trials, which took place for a couple of years to show how well this works. And we've been implanting it since late last year with some very good results. Just to go through what Axonics is, this is sacral, again, neuromodulation, or in English, sacrum is the bone in the buttock, and we're modifying the nerve signals which are involved with bladder and bowel therapy. And the nice thing about this is, again, it can help overactive bladder, urinary retention when there's no obstruction or no blockages, and or fecal incontinence, bowel incontinence. They can help any one, two, or possibly all three of these problems, and it's the same device done the same way with the same setting. So you don't have to do anything differently. You try this device. If it works, it can help all your problems, which is a quite nice in comparison to all the other therapies we talked about. This works through gentle stimulation of the nerve. So basically, if you think of a pacemaker, that's something that works in the way the heart functions. This works in the way the bladder and bowel function. So there's no buttons to push. This works in the background. It's not going to make your problem worse. What it does is you're not even going to know it's there over time. It's going to send a little gentle signal to the nerves to try and allow the bladder and or bowel to work more normally the way they should. Again, you don't have to actively do anything. It's very safe, and it's a very minor procedure, but can have a huge impact on your quality of life and really improve the symptoms which have been driving you crazy. So I think this is, it's a really nice change that came about last year. As you can see from the slide, the implant's quite small, about the size of a quarter, a small thumb drive, or some people have said Andes candy, for those of you who know what that is. But it's just a small, flat little implant. Again, it's rechargeable, so it lasts a minimum of 15 years, done through an outpatient minor surgery, which is quite nice. Axonics is full body MRI compatible, which is a huge change over the previous generation. You can get currently 3 Tesla for your head and 1.5 for the rest of your body, and it'll soon be 3 Tesla whole body. So for the most part, you can get almost any MRI you need, and that historically really has been the only restriction. So having this as an option, where this is 3T for the head and soon to be for the body, is really nice. And this is the patient remote. So this is what you would go home with. This is what you would see. No one would know. It's discreet. It's small. It looks like a cute car fob. Put your keychain. You can attach the keys. You don't necessarily need to carry it, but it slips into your pocket, a purse, really nicely. It's really intuitive. It's really simple to use, which makes it nice. For those of you who've seen the prior generation or the InterStim, which has been out for years, the remote control is a little cumbersome and a little challenging. This one's very simple, very easy to use, and again, discreet. So no one really know what you're carrying or why you're carrying it, which is important, which is nice. This is you can see the woman with that little white hockey puck-looking device over her buttock area. This is how you would recharge. So very simple. This straps around the waist on the belt, gives you a little feel. It vibrates, tells you when it's over the device. On average, you have to charge once every 1 to maybe 3 weeks. There's no harm in charging earlier. So if you charge every week, you may have to do it for half an hour. If you charge every 2 to 3 weeks, it may be an hour. You just put it on, you sit down, do something you want to do around the house, watch a show, and you let it charge, and it gives you 15 plus years of battery working. So very simple and very easy to do for the bulk of patients. So almost all patients found that charging was easy after a year. Now, this was based on the clinical trial. This is how it got approved. Over 90% found that charging the frequency and duration was acceptable. The vast majority, I think 95%, found charging every 7 days or less. They can charge once a week or less often. So again, almost everyone found it acceptable, easy, and at the most was once a week. And just, this is a patient who was involved early on, was implanted early. And she said, charging is as easy as anything. She can sit there, watch a program, read a book. She can carry a remote control on her keychain just in case she needs it, but she's never had to use it. So these are very common statements, very common sentiments from patients that it's easy to use, it's available, but they usually don't have to touch the remote, which is nice. Now, in the trials, they found meaningful and lasting improvements. So 89% of patients achieved clinically significant improvements in symptoms in 1 year. For those of you who don't do clinical trials and don't know statistics of bladder problems, this is really quite impressive. 89% success at a year for any treatment is really quite impressive. That means the vast majority of people had significant improvements in their urinary and or bowel symptoms, and these are really impressive numbers. And 1 year after the implant, over 90% of patients were satisfied with the results, which again, almost 90% had great improvement, and 90% were satisfied with their overall results and improvement. And these are people who failed medicine and possibly failed therapy and other options. And this treatment alone gave 90% of people significant improvement in their symptoms, which is really an impressive number. 93% of patients were satisfied with the therapy, and 92% would undergo the treatment again with the same expected results. These are really high numbers. And again, as you can see, people have been suffering for years, really saw significant improvements in their quality of life and reduction in their symptoms by a very simple, very minor outpatient surgery. And just another patient who's had an implant, just to give you a little difference, is a 45-year-old woman. The last lady was 71. So wide spectrum. This works for young, middle-aged, older patients, men and women. So you've heard me talk long enough about the overactive bladder and the treatment options. So now we're going to listen to a patient talk about how this implant has really improved their quality of life.
It was probably about 10 years ago that I really started noticing that I couldn't go more than an hour. If I felt like I had to go to the bathroom, I had to go right now, and I usually had about a 5 to 10 minute window. And if I didn't make it to the bathroom, then I would definitely leak. I went into a urologist, and they said it was just part of aging. And I had had 4 children and 2 really large babies, and it was just something I was going to have to deal with. So then I waited a couple years, went to a different urologist, internal medicine urologist, and kind of got the same answer. So when I was talking with my urogynecologist about my symptoms, he gave me a higher dose from what my internal medicine doctor had me on, and I tried that for 6 months, and I went back for a follow-up. And when I went in, he said, "How is it working?" And I said, "Well, it's fantastic." He asked me how many times a day I was going, and I said 15, because this was really great for me. And he said, "Oh, no, that's not that's not great. It's not really good at all." And talking about some other options, he brought up this new implant device. The size of the device absolutely did influence the decision. So just seeing the size of it next to a quarter, I believe, is the first time that I saw it. I thought, oh yeah, that's doable. That is something that I could handle. Being able to have a remote control and have complete control of something really felt like a no-brainer to me. It's just so simple. There's 3 buttons. You turn it on, you put it close to your body, and there it is. You can move it up, you can move it down, look at your battery life. I noticed my symptoms improve absolutely immediately. Going to football games for my son, it didn't matter where we sat. I used to sit right on the edge next to the bathroom so I could get there as soon as I can. Now I sit on the 50-yard line at the very top. I have the best seats in the house. It's just been fantastic. It is nothing short of really a miracle for what it has done for myself and my family. My urgency is gone. It's just completely gone. So it's almost as if I'm a different person. I'm happier, I'm rested. It is absolutely life-changing, and I could say that over and over again, just to make people understand that it is so fantastic to just live a normal life the way everybody does. I think that anybody who's thinking about doing it, it would be absolutely life-changing for them as well. I thought I'd be running around in a diaper by the time I was 60 for the rest of my life. I mean, it's so powerful for me. So that's probably the part that I just want to drive home is there's nothing that I can't do any longer. I can do whatever I want, and I don't have to worry about something silly like having to go to the bathroom. Wow.
So now it's time, we've talked about some of the treatment options. I assume most of you listening are really bothered, and hopefully you're ready for some symptom relief, ready to talk about the next step in improving your care and improving your quality of life. So how do we get started? Well, you can schedule a consultation to determine where you are in your treatment journey and confirm if Axonics is right for you. Again, you can trial the therapy, which is really nice. You can do an easy office test, lets you experience firsthand if this therapy works for you. And the nice thing is there's really minimal to no risk from the treatment trial. You'll really get a chance to see how well this works for you. So the next step, you can schedule a telehealth video appointment with me through Chesapeake Urology. Hopefully soon we'll be able to see people in the offices again. But certainly in the short term, a telehealth video appointment would be a way to start your treatment. We would be happy to see you and kind of go through what options you may have. Go ahead and, when you're ready, schedule your next appointment today. And so I'd like to thank you for listening and for watching, and certainly, hope to see those of you who are interested and bothered by your symptoms. I think there's a lot of things we can do to really help you. So thank you very much, and I hope you're all safe and doing well.
We appreciate you attending the webinar this evening. If you are interested in scheduling a telehealth visit, please visit our website, ChesapeakeUrology.com, and click on the telehealth appointment tab. Thank you, everyone. Again, if you have questions, email webinars@cua.com, and someone will be getting back to you. We appreciate you joining us today, and we hope that you join us in the future.